Welcome back, Lorri. I'm so happy we're doing this.
Thank you for having me. It's great to be together.
We are going to go right into advocating today. This is a hot topic. You know, I talk about it all the time on social media, always getting lots of reaction, both good and bad. But I'm not going to stop because it is so important for us to find our voice. And that's what I say. And I know you are an intrinsic coach, and I think maybe it would be helpful to help people understand what that means. But my thinking is that it's similar. Like when I say find your voice, you sort of have to go inward and figure out what that is.
Totally. My journey as a doula evolved into as I slowed down my own doula practice. I was really intrigued to move into coaching, and so I became a journey of intrinsic health coach. And and in both cases, as a doula and as a coach, is that you're not coming up with answers for anybody. You're really helping them come up with their own answers, and that's about probably asking some really good questions and then sitting back and really actively listening so that you can hear what's right for you, whether it's the doula clients or whether it's the personal coaching clients that you're working with, so that they can learn to use their voice and advocate for themselves when they need to.
And why is that so hard for so many of us?
I I think it's so hard for so many people because we're not taking the time to do it. We are thinking that the answers are outside in versus inside out. And it sounds trite to say like, oh, okay, just go within, like you already know the answers. But one, in the middle of a contraction, in the case of pregnancy and birthing, one, it's easy to forget that the contraction is going to end, or forget what you thought you knew or that you planned for before. Maybe we'll talk about birth plans at another chat. But for to remind you of the information that you know, or to trust yourself versus all those outside voices. We did talk before about tuning out the noise and tuning in. It really is about tuning in, but not very many of us are doing it. And then listening to the answers.
Yeah, you're absolutely right. It is very difficult in the middle of birth to find your voice, especially mid-contraction, and to really be able to find the words. Like I think you called it labor land. Like you really are in this other universe. Especially if you're unmedicated, you're very like you're out of it.
Yeah.
And it can be so difficult in those moments specifically to, when you're being asked to, oh, we're just going to do another cervical check and that didn't feel good to you last time. Or it's like, oh, it's time to get on the back and your back, like doctor's here, time to push.
Right.
And it's not like you're being given a choice. You're being told this is what we're about to do and this is what you now need to do. You need to comply. Like, oh,
Right.
it's hard. And so I would love to know your thoughts on situations like that and how to find your voice.
Yeah. Well, one, I have a little bit of a um, bicep biased perception, I guess, because I only know the births that I'm at, and therefore the births that I'm at are with a doula. So I can remind people to use their voice. But I remember you once asking me, Nikki, like how do you get a doula to advocate for you? Or how do you find a doula who will advocate, for you? And it's not a doula's role is really not to advocate for their clients when it comes to being at the birth. And I know that sounds weird to say, but people need to hear this. A, a really good doula is going to help you know how to advocate for yourself
Mhm.
and to work with you enough prenatally so that you have the information and the education to present it in a way that, um, to say, I need a few minutes, please. Can my partner and I discuss that together first? Or unless there's an emergency where something needs to be decided on immediately, which doesn't happen that often, that you have the option to say, you know, to learn what other information you need to make these educated decisions. Maybe we can get into using your brain as being an acronym.
Yeah, let's spell that out. I love this acronym.
Okay.
So benefits.
Yeah. So the benefit, is understand if something is being suggested to you, this can be used in birth, but it can be used outside of birth too. If something is being suggested to you, what are the benefits of doing that? What are the benefits of going down that road? That's generally pretty obvious. And sometimes the person who is suggesting what next steps, they're obviously telling you the benefits. You can ask about the risks. and that you need to know what the risks are to doing that. So that's the R in brain, the benefits, the risks. I always have to go through and like, how do you spell brain in this? The next one is A, is alternatives. So what are the alternatives? So if I'm being told that we need to break your waters now, we need to rupture membranes, that sort of thing. What are the benefits to that? What are the risks to that? What are the alternatives? What if I wait? Right. So what are then they're going to go into the advantages and possible disadvantages, and then knowing what alternatives are is important. And we're going through all these. I don't know about all doulas, but I'm going through kind of some, I don't call it a birth plan, but it's a birth options worksheet that we're going through, so that you're bringing up different topics that you might not even know that you don't know. You don't know what you don't know. And so you're bringing it up so that you know whether this is something that, yes, I for sure, this is something that resonates with me. This would be the goal. Or no, that's something I really want to steer away from. Or I need more information. And that's what, part of that brain is. So benefits, risks, alternatives. I is important to me. I is probably most important to me. And I guess you know me really well, Nikki, so you would know this about me, but intuition or information or intrinsic health or in going innately, like what feels right. All of those are I words. And that is what's really, now I've got the benefits, I've got the risks, I've got some alternatives. Now I'm going to check in. Now I'm going to, remember when we talked about tuning out the noise or the shoulds? Now I'm going to go inward, another I word, and use the I word to feel like what feels right to me. And then the N is, I either need more information, please, or nothing. What if I do nothing?
Yeah. Yeah. Essentially waiting. I love that. And it's so powerful to have a framework like that to help you. And obviously you'd be running through this pretty quickly in your brain, right? Like, you'd be sort of like, okay, like the cervical check example. Let's go through that. I like that example. I personally wasn't bothered by them in pregnancy, and I was sort of during labor. And I was sort of like, I wanted to know. I was like, benefits, okay, well, really, I know it's arbitrary, but I want to know how they're measuring my cervix. It was motivating. I wanted to know, like, approximately how dilated am I?
Right.
Risks, maybe infection, discomfort, right?
Yeah. Or for some people, if it induces more fear, then it can slow down the process.
Alternatives, I mean, you could kind of look at how somebody's moving, swaying, right? Sounding.
Yeah, you're reading birth differently than just by the number.
Yeah, exactly. Intuition, and this is so true. For me, I was like, I want to know, like it motivated me. Whereas I think, I'm sure you've been with people who are like, no, that's going to completely distract me. It's going to be demotivating. It's going to throw me off my game and potentially like get my, mess with my oxytocin levels and get me in a bad headspace, right?
Right. I being most important there with most decisions is just taking that moment. It can literally, like you said, be 5 seconds of like, okay, yep, that feels right. Or like, oh, I need a moment, or I need a couple of minutes. Can I discuss this with my partner? So yeah, it's just taking that, like, pause, just take a breath, take a pause. Does this feel right to me? And yeah, sometimes it is super motivating and people need that in the case of an internal. And sometimes people are like, well, I'm spontaneously pushing and this baby's coming out, so I don't care whether I'm 9 or 10 centimeters dilated.
Yep, the freight train is coming.
Yeah.
And then the do nothing. I like to say in the push pro course, I'm like, give them the finger. And everyone's like, oh, and I'm like, the index finger, where you're like, just pause, just a second.
I think that came from our Childbirth Without Fear and pushing that we did together, is that I gave my clients permission to give their primary healthcare provider or nurse or whomever they're working with the finger, and then I held up like, okay, the nice finger, like the pointer finger, like, and that just means right, just give me a minute. So yeah, I need a moment just to, especially if you're in the middle of a contraction. Well-meaning, loving people around you tend to ask you questions whether you're in the middle of a contraction or not, and in most cases, in the middle of a contraction is not the time to be, going into your left brain and thinking about what you should or shouldn't be doing. It's, you just need to be in that moment, and the finger, the nice finger versus the finger, is a nice way of just pause, like pause, hold on a second, I need a moment.
Yeah. Oh, so good. Such good tips. Brain, benefits, risks, alternatives, intuition, intrinsic, inward, all the I words. There's so many of them. And do nothing for
Do
that.
nothing or need more information. And that's a time when sometimes as a doula is that what questions do you need to ask to get the information that you need to make the next best decision for you?
Such good tips. Advocating for yourself. Brain, you got it. You got this, everybody.